Team, king and a queen, gold crowns, everything.
Hello, it's a good day. I'm Cristian Totto from Tumawini, Isabela. I'm a student nurse from Isabela State University, City of Ilagan campus. And for today, I'm going to make a return demonstration about blood glucose monitoring. So let's start for the procedure. So first procedure, I'm going to introduce myself to my patient and identify the identity of my patient to execute the right procedure to the right patient. And especially, I'm going to review my orders for my patient. So ma'am, I'm Christian Abaytoto from Tumawin, Isabela, and I'm your student nurse for today. And can I ask your name po?
Celine Reyes,
Okay, your birth of date?
November 13,
Okay, great. Next procedure, I will going to explain the purpose and the schedule for the test to my patient. So ma'am, I have some procedure to execute for the test of blood glucose. So ma'am, may I ask your permission or consent before everything?
Yes.
Okay, great. Next procedure is provide information regarding the test, and I will going to inform my patient the importance on it. Okay ma'am, the blood glucose monitoring, it is really important to you to know your blood sugar, if your blood sugar is normal or beyond normal. Okay, next procedure, I will going to gather all the equipments or apparatus needed in the procedure. So after gathering all the equipments, the next procedure, I will going to wash my hands or sanitize my hands using alcohol. And after that, I'm going to wear a pair of gloves. Okay, next procedure, I'm going to prepare my patient and asking his or her. So ma'am, may I ask you to warm your hand doing grabbing like this? Okay, that's great. So ma'am, may I ask you to put your hands in the table and relax? Okay, that's great. So make sure the hands of the patient is below level of the heart, and or asking my patient open and close his finger or finger. Okay, that's great.
The first thing to do is to assess the patient's puncture site. It is important to check the patient's puncture site, especially the fingers, for any signs of inflammation, redness, bruises, swelling, and edema. It is important to check for this because these are the particular signs that we want to avoid if we want to conduct a CBG monitoring. And keep the area to be punctured in a dependent position and do not massage the puncture site. And avoid having the patient to stand during the procedure. The next step is put the lancet on the lancet device and then gently squeeze the tip of the lancet and remove it. And then cover the lancet device. And then adjust the appropriate number on the lancet device.
So next procedure, I'm going to wipe the area with the alcohol and allow to dry.
Remove a reagent strip from the container and reseal the container cap. Do not touch the test pad portion of the reagent strip. And then place the reagent strip on the glucometer and wait until it's automatically on. 1, 2. Gently squeeze the finger above the site to produce a large droplet of blood. Wipe the first drop of blood, then transfer the second drop of blood to the reagent strip. Then immediately press the timer unless it starts automatically with insertion of the reagent strip. And then check the result on the unit display. This is the result. Apply pressure or ask the patient to apply pressure. We're using 2 times 2 gauze pad or clean tissue to stop the bleeding. So check again the result. After checking the result, turn off the meter and dispose the test strip, 2 times 2 gauze and lancet, and disinfect the device that you use.
So the last procedure, I will going to remove my gloves, then wash my hands or sanitize my hands using alcohol. And the most important here is to note or documents all the results. So that's all for the procedure of blood glucose monitoring. Thank you.